I'd like to welcome you all to one of the webinars we're doing in preparation from the IHE North America Connectathon week. As you can see, being held in Toronto, February 3rd to 7th, 2025. And this particular webinar is really going to describe something that we've never done before, and that is creating a theme that's going to cut across the entire North America Connectathon week. And this theme is around the International Patient Summary, IPS. I'm very pleased to be joined by two very distinguished speakers, and we'll get to that in introductions in a moment. Next slide, please. Thank you. So first of all, thanks to all of you for joining. As we always do, this webinar is being recorded and will be posted online on the YouTube channel that IHE International supports. You can just search for IHE International, or you can use that QR code if you like to go to the YouTube channel. The video of this webinar, together with this slide deck, will be available at this site. So hope you're able to access it okay. During the webinar, we would like to have your comments and questions. And we're muting the mics, but instead we will invite you to put your input into the chat, the chat in Teams. And at the end, if time permits, we'll get to your questions. Some of the questions might be answered online by our speakers as we go. If we don't get to your questions at the end, then we will endeavor to get back to you with answers to your questions by email. Next slide, please. So I very much like to introduce our panel today. It's a distinguished panel, and it's very much made up of experts around IPS. So first of all, for me, my name is Mike Nussbaum, and for those of you who don't know me, I've had a lifetime career in digital health for over 40 years, and I've been a consultant and strategic advisor for most of that time. Over the past 15 years, I've concentrated on standards and interoperability. As a director on the IHE International Board, as a delegate to ISO TC215 Health Informatics Committee, covering, Health Informatics, and as a former director and vice chair on the HIMSS Board, and as a member and former chair of the Joint Initiative Council on Health Informatics Standardization. Lots of organizations. I've been a longtime contributor to the evolution of the International Patient Summary, having led the development of the first of two IHE IPS profiles. And I currently participate on the IPS coordinating committee that's under the JIC. I'd like to also welcome John D'Amore. John D'Amore has over 20 years experience providing informatics and strategic insight to healthcare organizations. He's currently president of More Informatics, teaches at Boston University, and was previously founder of Diameter Health. John has published on best practices for interoperability and is a regular presenter at national and international forums like HIMSS, AMIA, HL7, and ONC-ASTP. He is extremely active in the cross-SDO development of IPS specifications and serves as a technical workstream lead for the IPS workstream through the Global Digital Health Partnership. Welcome, John. John also will be at the Connectathon as a Connectathon monitor. We're very pleased to have him participate there. Lastly, I'd like to introduce Daniel Berrazzano. Daniel is probably well known to most of you. He is a healthcare technology expert with nearly 20 years of experience. He is the Gazelle project manager for IHE Catalyst, and he has facilitated the testing of healthcare IT systems in Connectathons all around the world. Daniel is also deeply involved in shaping healthcare standards, having served as the planning co-chair for IHE's IT Infrastructure Committee and also on the IHE International Board. And Daniel happens to be in charge of most of what's going on at the Connectathon from a technical standpoint. He's the technical project manager for the Connectathon 2025. So welcome to John and Daniel. Next slide, please. So today's agenda, I'm going to very briefly cover what the Connectathon week entails. Then John will step up and talk about the International Patient Summary, the IPS global movement, and also how it's being implemented locally here in North America, but also around the world. And then Daniel will dive into how IPS theme at the Connectathon week is going to work. And this is something new, and I think you'll be really excited about what we're able to offer here for those of you who are really interested specifically in IPS. And again, as we have time, we'll do a Q&A Again, a reminder to put your questions in the chat. Okay, next slide, please. So there's been a long history of Connectathons. Just quickly, the first IHE Connectathon was held in 1999 in Chicago, and as most people remember, it was held in the parking garage of the Radiological Society of North America. In North America, this is our 25th year of Connectathon testing. Since 1999, there have been approximately 100 Connectathons held worldwide. Connectathon countries have included the US, Austria, France, Germany, Italy, Luxembourg, Netherlands, Spain, Switzerland, Turkey, Korea, Japan, Brazil, Australia, and China. North America Connectathons have been held in Atlanta, Austin, Chicago, Cleveland, Oak Brook, Illinois, and San Diego. But this is the very first Connectathon ever to be held in Canada. So we're actually thrilled to have it in Canada. As a Canadian, I can say that. Connectathons worldwide have been held in universities, convention centers, and hotels, a boat terminal, a former convent, and a former tram repair shop, and of course, a parking garage and a tent. So here we are coming to Toronto in February. It is a Connectathon week. There are 4 major events going on during the Connectathon week and a lot of other ancillary events. But the 4 major events are IHE Connectathon testing, IHE Plugathon, the IHE Experience Days Conference, and an IHE Projectathon, or a Pan-Canadian Projectathon, taking that interoperability to a localized environment in Canada. Daniel will cover the details of all these 4 events. I wanted to say that the venue of Toronto is great. It's my hometown. This is being held at the Intercontinental Toronto Centre, which is a major hotel right in the heart of downtown Toronto. So I think you'll really enjoy it as a venue. Next slide, please. So this is just an overview of the various events that, again, we'll go into detail in terms of how that applies to IPS in a moment. Just wanted to say that there's a lot there's a lot of value in each of these events, and it is something that we thought might be very, very valuable for those of you who are interested in the International Patient Summary, because what we've done is we've programmed IPS into all of these events. And so we'll get into that in more detail later. Next slide, please. Just to say also that there's something for everybody. People from jurisdictions, from vendors, vendor communities, health organizations, subject matter experts, clinicians, what have you. There is something during this week that will be of benefit to all. Next slide, please. So what we've done here is we've created an IPS theme. We haven't created any new events, but what we've done is we've created a focus from IPS on all the events. And if you could just put the next click on, Emily, some very specific events at each of these events, each of these sections. For example, at the Connectathon, we have 2 IPS profiles, the IPS and the SIPS profiles for actual Connectathon testing. At the Projectathon, just as an example, there will be this is Pan-Canadian Projectathon. This is the Canadian specification that is built upon IPS and IHE foundations. So there is something there as well. In Experience Days, which is the conference, as an example, the World Health Organization is going to speak on leveraging IPS in a very interesting use case, which is the Hajj, which is the pilgrimage to Saudi Arabia every year. And there's also another topic around IHE and fire. This is IHE and HL7 working together with IPS as a particular emphasis. At the Plugathon, there are a number of tracks, including fire-based IHE profiles, which include IPS, as well as IPS and trust framework integration. So some very interesting discussion topics at the Plugathon. And we've created something called an IPS Focus Pack, and you'll hear more about that in a moment. It is really a package with a special price for those that are really interested in only testing or participating in IPS at the Connectathon and Plugathon. So you'll find this very attractive as an option to participate. Next slide, please. I've provided these links and QR codes. There's lots of documentation. There's a web page specifically on the IPS theme at the North America Connectathon week, and there's the QR code for that. Also, the general page on North America Connectathon Week with all of the activities and all of the social events and all of the registrations that you need. And then for the international patient summary, if for some reason you've never been to the IPS website, there is a website where all the specifications live and all the implementations around the globe and everything you'll ever wanted to know about IPS is available at the IPS website. Next slide, please. And with that, I'd like to introduce John Demore of More Informatics. Thank you for coming, John. Take it away.
Awesome. No, thank you so much, Mike, and thanks everybody for attending today and really being interested in participating in the upcoming IHE Connectathon in Toronto. I'm really excited to be there in February. Next slide. So just as a very high level introduction to IPS, I know many of you may know it already, but the IPS, or the International Patient Summary, is a standardized set of clinical data about a patient. And it's meant to provide those most important medical facts. And you can see in the second bullet there, it's a summarized version of that data. So it's not meant to be a data export of everything that's in your electronic health record or your other source of information for a particular patient. This is really meant to be a summary that's really meant to be able to inform a care provider or other caregivers at part of a care transition. I've underlined a couple words about it. The IPS is minimal and non-exhaustive. So that really does go to the idea of a summary, but it's also specialty agnostic and it's condition independent. So specialty agnostic means that it really can be used across multiple different use cases and scenarios. It's meant to provide that minimal set of information like allergies, problems, medications that are going to be useful in almost all care scenarios. And it's also condition independent. The primary use case for the IPS, or the International Patient Summary, is for unscheduled and cross-border care. And that word cross-border is really important. So, a lot of people think about the IPS and they say, well, it has international in the name. So it really is only for some, context where I'm getting international medical care or international travel. And the answer to that is no. Certainly that is one of our use cases, but there are other types of borders that are incredibly important. They could be provincial borders, they could be state borders, regional borders. They could be organizational borders. So even if you're just going down the street from one hospital to another hospital, they may be using different systems, and that presents a real organizational border to the sharing of information. So even though it says international in the name, the International Patient Summary really aims to be a base for all of those use cases for care transitions, and primarily focused on unscheduled care as well. What are the sections? So if you go back just one sec there, what are the sections in the upper right? So I mentioned a couple of them already. So problems, allergies, and medications are ones that are required as part of the IPS, and that's really specified in the ISO 27269 standard that we'll speak about in a little bit. But there are also other sections that you can provide as well. Three of the ones that are probably most commonly used are immunizations, diagnostic results, and past procedural history. But there are 10 other sections as well that are available in the IPS. In addition to those 16 sections that are profiled, you can also provide other data. So even though it's meant to be minimal and non-exhaustive, it's not a closed set. It does allow for adaptations to specific use cases. Next slide. So IPS implementations or planned implementations. I mean, this is what is really exciting, because even if you just backed up 1 to 2 years ago, and if you were to try to fill out this slide, we had a couple people that had moved forward, a couple organizations that had moved forward to support, but the names are growing. And I'm going to be the first to apologize. I apologize if you know of organizations that we haven't listed on this slide for it. These are the ones that we have, and we're posting on the international-patient-summary.net webpage for it, but also ones that have made public their implementations or planned implementation for it. And these things are really across the world. So you look about Australia, New Zealand for BES, Epic and Mediated, which have very international footprints for it. Common Health, which is a patient health record app in the United States. Smile, which is very international, Virtue, patient-centric solutions, and Verisource, which is supporting a live implementation for every patient available in New Brunswick, Canada, for things. And in the upper right, you also see the My Suhatro app, which is really meant to support that use case for the Hajj pilgrimage, which went live this past summer as part of patient individual travelers to Mecca. Next slide. So those, are some of the vendors that are supporting it, and really some of the key achievements that we've really seen just in the past couple of years around IPS is that we have cross-border implementation across really whole continents through the Hajj use case. So that app that I mentioned there is shown on the left for it, which allows for an international patient summary to be carried as a QR code with the patient, and that QR code essentially provides access through the GDHCN, or Global Digital Health Care Network, that's part of the WHO aspects of being able to share that information. They had over 250,000 certificates that were issued as part of this last Hajj pilgrimage, and over 10,000 actual health records that were accessed as part of that. So really exciting to see that. And it's multiple nations, Malaysia, Oman, Indonesia, Saudi Arabia, all working to make that possible. In addition, one of the other kind of implementations of IPS that we're seeing that's very exciting is in Central and South America as well. So they recently had a LACPAS Connectathon that is merely aimed at strengthening the construction of the Pan-American Digital Health Roadmap, and they tested the IPS just in October, so just about a month and a half ago, for being able to exchange that. And we're seeing individual nations within that highway again use the IPS as a domestic-based infrastructure and patient summary for exchanging information during care transitions. This is really just so exciting. Mike has been working on this for many years, more than myself for it, but over the past 4+ years to see the actual real live adoption, uses, and really, what we're all in this for is being able to improve that patient care that comes from information exchange as part of this. So just a really exciting blossoming for the IPS and growth over the past 3 to 4 years. Next slide. So Mike mentioned earlier, but in case you missed it with that QR code, international-patient-summary.net is a website that has a very friendly way to introduce this. It's really not meant to be, it's not part of the technical standards, but it's really meant to be a very useful website that regulators, patients, clinicians, people who are interested around the IPS and want to learn more to understand it can go to. It is also a great place to stay up on the news. So you'll read about those things that I just mentioned from invitations on the prior slides, as well as several others on this website as well. I'm pleased to be an editor with many other people who volunteer to actually help curate this website and keep it up to date for this. We also have a very active LinkedIn account, so you can go to International Patient Summary on LinkedIn and go ahead and follow us there as well. Next slide. So Mike alluded to this earlier, and I talked a little bit about the ISO 27269 standard for it. But if you don't know all the acronyms or all the pieces of the slide, the one thing that I want to leave you with is that this is a very collaborative, cross-SDO, cross-standards development organization set of work that's really come together to make the IPS a reality for things. On the left-hand side, Sen and the work in Europe really provided some of that early guidance for the 17288 and the 27269 as part of their standard, which became the ISO International Standards Organization standard that really provides the abstract data model for the IPS. The ISO model is implemented in 2 different HL7 content standards, which include the IPS CDA implementation guide and the IPS Fire implementation guide. Now, most of the activity is really focused around the IPS Fire implementation guide, and that's where you can see the IHE SIPS profile really points, but it's also one which has really garnered the most excitement, and we do expect to be tested most frequently at this upcoming Connectathon. These standards also use the SNOMED IPS terminology, which is a Creative Commons license to SNOMED CT terms that have been made available again for the use of SNOMED information, codified information in context of the IPS. And it is a sub-ontology, so it's not really just a list of free terms being available by SNOMED. So really great content and great work that's been done across these standards development organizations to make this possible for them. Next slide. So I think that this is my last one here, and I'll give a couple kind of closing remarks. But my work with the Global Digital Health Partnership, what is GDHP for it? Well, it's 40 countries, territories, and nations worldwide that have come together to advance digital health. There are 5 work streams associated with this, but one of them is focused on interoperability. And within that interoperability work stream, I'd say the IPS is the primary area where they're working. Not the exclusive, but it's one where we've seen the most adoption, most progress over the past several years. GDHP was formed in 2018 for it, but has grown to those 40 different members over time. The original focus for IPS was patient-mediated exchange, which is being able to get that advance from the standard, allow patients to carry their data with them for travel or for other purposes for it. But we have seen really some support really in the last 2 years around emerging trust networks like the GDHCN for the provider-based exchange of that information as well, which uses a whole host of IHE profiles for the exchange of that information. GDHP provides a venue for nations to learn, connect, and discuss activities related to the IPS fire standard, but also to the other IPS standards as well, and support for Connectathon activities. So while I can't speak on the behalf of GDHP, I'll certainly say one thing myself for it. I'm really emphatically supportive that the IHE Connectathon and Plugathon and really the focus that they have for IPS theme at the upcoming North American Connectathon is just incredibly exciting, and it really complements the other things that have been done. So if you participated in prior GDHP mini Connectathons or HL7 Connectathons and really been participating in that IPS track for it, this is a real opportunity to use some of the IHE infrastructure to be able to test at scale IPS exchange. And I think it's just a really exciting to see this come together. And it really, I think, is going to provide a tremendous amount of great support and opportunities to learn for the vendors who are interested around IPS as well. So, just a very supportive endorsement. I know that Daniel's going to go into a little bit more details around the particulars of the event for it, but really excited to see this come to light and come to being for it, and very excited to participate in my role as well. So with that, I think my next slide here is a handover to Daniel. So I think that it was given the introduction was given earlier for it, but I'll also just repeat. Daniel's a healthcare technology expert with 20 years of experience developing cutting-edge solutions. He is the Gazelle project manager for IHE Catalyst, where he provides a crucial role in advancing healthcare interoperability worldwide and has facilitated global health IT systems and connectathons for it. So with that, I'll hand it over to Daniel to run us through a little bit more of the logistics for the week.
All right. Thank you very much, John. That was very insightful and very interesting. I actually learned a couple of things while you were presenting there. Thank you for that. I'll quickly run through at a high level what the Connectathon does, what it stands for, where it comes from, what the Projectathon, what the Plugathon is, and then try to help clarify the continuum between the different events. And then I'll dive into some SIPS specifics that we're testing at Connectathon, and then some of the specific options that we also have for IPS that are also tested at the Connectathon, and by presenting the IPS theme. So we can move along to the next slide. IHE focuses really on interoperability. And interoperability is basically the capacity of a system to exchange data with another system without the need to adapt the interface. You could see the standardized interfaces described in this drawing here. And interoperability is achieved by specifying the interfaces between the systems and which ones to use in particular use cases. That's how IHE works, by creating these use cases, finding the standards, and then implementing them, then testing them at the Connectathons. We can go to the next slide. At the Connectathon, we test these use cases that we call profiles, really, and then actors. Actor A is an implementation, and actor B is the responding implementation. Sometimes we have server client. In this case, we're really being more agnostic by calling them just actors in profiles. The test information exchange with other systems happens in a structured supervised peer-to-peer testing environment. What that means is that there's monitors like John and Michael and myself that will be able to look over your tests and help find the differences. When you're sending something to another partner, you really get into a much more complexity than when you're testing with just a reference implementation, because in the real world, there's additional things that appear, there's things that often deviate from the expected behavior, and that's when the interesting part happens. And doing this peer-to-peer testing at the Connectathon reveals a lot of what we're going to have to face once these technologies are really in the field. And it helps us get so much closer and make the adoption smoother. So the detailed validation of interoperability and conformance with the IHE profiles is done through this interoperability testing peer-to-peer. You're going to be sending your data to 3 of your peers, and for each one of the different profiles, validating that you're actually interoperable with your peers. So there's also this feedback loop that happens during the Connectathon, where if we find something out, we can sit down with the folks that wrote some of these standards and give constructive feedback of this works, this doesn't work, I read it this way, I read it that way, then a change request goes out. We often put change requests to even some of the underlying standards. As you've seen, this is a cross SDO collaboration effort. There's also testing and debugging that happens to remove a lot of the barriers. And so you're working with side by side with your competing, but also in a collegial environment to help remove some of the little frictions that happen in interoperability. And so it's a great way to move your product forward from I've developed this and I'm actually sending this to some of my partners before it goes out to the field. And then the successful outcomes are published in our result repository as in evidence of interoperability capacity. We also have a seal that is published that you can use as part of your marketing collateral. We can go to the next slide. That was the Connectathon at a high level, what we're doing there. And I just want to present it in the context of a testing continuum. To the left, we have what we call enablers. We consider the HL7 Fire Connectathon to be an enabler because it helps progress the Fire standard. We consider the IHE Plugathons also enablers. And other hackathon events or other industry events. And these are input to build the standards, build the profiles, and go to the Connectathon. At the Connectathon, we're able to assess, refine, and give feedback. And then these eventually go to Projectathon. You can see here there's a divide between the IHE managed events that are really at the Connectathon level and the share zone. The share zone is a place where we host artifacts, and you can exchange documents using this. It's very much used in radiology today, but it could be a really good potential way of also exchanging IPS documents in our use case here. And then I wanted to go to the Projectathon that is managed by a jurisdiction. It could be Switzerland, France, the Latin LACPAS countries, or in our case, Canada, that is having a Projectathon during the week. And at the right, we have the quality controlled artifacts. So there's a Connectathon results database that's accessible. We've got project labeling that can happen after a Projectathon or conformance. And we've also got the seal. If you click on just a space bar, it should appear. And we've introduced this last year, was the first year at the North American Connectathon that we were able to generate and grant the seal to the participants that successfully passed. The seal stands for an exclusive official international attestation provided by IHE, and it endorses the quality of interoperability implementations in the vendor's product. We hope that the presence of the seal logo on product and services is more closer to a formal indication of vendor's conformity and establishes a certain degree of interoperability. And so this is another thing that we're offering alongside the Connectathon. Can we move to the next slide? All right. One of the standards that we'll be testing at the Connectathon is SIPS. And as you've seen the collaboration, I don't think we included this slide here, but each one of these SDOs that are participating here has specific roles. In our case, IHE provides some of this technology on how to share the IPS. And IHE has different mechanisms. We've got basically your push protocols, MHD, XDR, XDM, that are transactions that enable for a sending of the IPS summary. We've got the exchange mechanisms, whether we're talking about XDS, the traditional, or MHDS, a FHIR-based exchange mechanism. This is where it will be pulled by a consumer instead of pushed by a producer. We don't have much in federation of IPS exchanges yet, but I think that's an interesting area that could be something that we actually discuss during Projectathon and get your input on that and how do we build that. MXD is a way to extract fine-grained elements of IPS resources. And we basically use a standard process to test the content as long as your IPS is a basic ISO IPS document. We'll validate it against standard industry tools such as Gazelle, NIST, or Matchbox. And from that, you're exchanging it in one of these mechanisms which you pick, and a consumer is able to do something intelligent with your IPS, whether it's just show it or use it or extract some elements out of it. And that's how you get conformance from IPS. We also have some higher level use cases, if you wish, where IHE's PCC committee has created options to the IPS to have additional elements that aren't in the vanilla or the basic IPS. We've got provisions for advanced directives, a plan of care, social history, vital signs. There's a lot of options there, and those were also tested at the Connectathon. This is really at a high level. We could go much more in depth on this, but I just want to give you an idea of the more formal tests that we have already planned at the Connectathon. And Emily, if we could go to the next slide, I think painting a picture is worth 1,000 words, and I've got 3 of them in here. This one to the right is in Switzerland. The one in the top left corner is at RSNA this year in February, and the one at the bottom, I think, is in Rennes from last year. And so we gather people on the tables and we exchange. So you can go over to your colleague and really tap on his shoulder and discuss. I've received a transaction. It's not what I was expecting. Can you send it to me? Can you display it? Can you show me what you're seeing, and so forth? So it's a really very effective way of progressing. All right, I will move on to the Plugathon. This year at the North American Plugathon, we have 5 tracks that are in the works. We've got leaders right now for all 5 tracks, and we're going to be able to publish the schedule for each track, I believe, early next week. But what is it really? It's an opportunity to learn to share, to test, and to shape. As you've seen in the chart I was showing earlier, the Plugathon is an enabler. So when you look at the standards maturity, it's something that comes before Connectathon. It's when we're working on the future state. How are we going to be merging IPSs? What are we going to do to govern federated exchanges, to do the innovative things that we want to do in the future that aren't yet ready for very formal testing because we're still working on the standard. But we want to have a collaborative space to exchange between the vendors and the users, because that's what IHE is at its core. It's an association between the users and the vendors. Given today, the users of IHE are really more from a jurisdiction level, and we've got a lot of governments that are looking at adopting this, and it's a safe space to discuss. So you're going to gain insight into the emerging profiles, as there's a lot of education that happens through the Plugathon. We try to get everybody on the same page before we dive into discussions. You get to share, exchange experiences and challenges encountered during the implementation of profiles and early profile adoption with domain experts that are present. You get to test preliminary prototypes in a controlled environment. Being part of Catalyst, we participate in a lot of these international projects that we see adoption of IPS. We've got some tools. We can help do some validation of QRs, and we've got additional tools to do this early testing before they become standards. And when we're working in that direction to get early feedback to incorporate it before it goes into trial implementation. This year at the IPS and patient-mediated access track, that's really the one focused on IPS, we're going to talk about the continuum of testing. We've got some specific testing events of the QRs that we've got planned. We're planning a session for cross-border exchanges with some folks that are actually doing it. We've got the experience of the Hajj Michael talked about earlier. And we will also have a number of joint sessions with the Pan-Canadian track, because there's a Pan-Canadian interoperability track. I'll dive into, at a high level, what Canada is doing during the Connectathon week. On the next slide, we can see they have a Projectathon that covers PSCA. CAFEX is essentially the exchange of IPS on fire, MHD, that is a transport and exchange mechanism, IUA is a security mechanism. They have audit, consistent time, and that goes in the Projectathon because they're at a maturity level that's far along the road that they can actually do some very specific tests. But they've also got a bunch of tracks that are in Plugathon stage that they're still in development and want early feedback, including CAFEX, but newer versions of it. MCSD, CA Core, that's the Canadian Core Plus. Hello, that's a way to open things in context. And there's a number of tracks around IPS. And our IPS leader, I didn't say it, is going to be Ilana. That's the IPS or PSCA owner in Canada, the product. She's been quite involved with HL7. Can we move to the next slide? Right. At a high level, this is what's going on in Canada. We can see from the IPS elements which ones. So the blue are heterodomains, the red are required, the orange are recommended, and green are optional. Gray are the common ones, and you can see that the different provinces have different levels of maturity and needs, and they're going to be able to work with the jurisdictions that are involved there. I'm not going to go into more detail. And so the Pan-Canadian summary is aligned with IPS. We can go on the next slide, including adaptations for Canadian health context that you can see here. critical engagement will be part of the Projectathon. Now, if we go to the next slide, I guess you're wondering, well, where do I go? Do I go to the Connectathon, the Plugathon IPS track? How can I do all this? We're realizing how much planning goes into attending these events and how difficult it is. There's pros, there's cons, it's complicated, it's expensive, it takes time. And we're hoping to create a track that takes away some of that complexity and analysis. And so we came up with the IPS Focus track that is on the next slide. Essentially, you're getting to do the Connectathon specifically for IPS-related profiles and participate in the Plugathon that will contain parts of the Pan-Canadian Plugathon. So this will include a one-system registration for Connectathon, including the IHE Connectathon seal for IPS, 2 badges for 2 participants to attend the testing fluoride Connectathon, and then 2 registrations for 2 participants at the Plugathon track. And we're doing this for a special fee of $5,000 Canadian. It's a great reduction if you try to package it from the regular price. We have a registration, and we're really excited to do this new focus pack. And I will give the floor back to Michael at this point.
Okay, thank you very much, Daniel, and thank you very much, John. I think you covered the ground really well. Just a couple of, first of all, I'd like to encourage questions if there are any. There aren't any yet, but if you put your questions in the chat, we can certainly have our experts provide some response. I'd like to just close by saying that having been involved in IPS internationally for some time now, I see this Connectathon week as one of the must-do opportunities. If you're doing any work in IPS, if you participated in other venues, this is going to be a major event that you really want to participate in. There's so much here for you. It complements everything you've done before, and it will inform things you do after. It brings together, even though it's focused on North America, it's going to bring together the world. There are participants that are coming from across the globe to this. It's very internationally focused this week. There are so many ways to engage. You can engage directly in testing with the IPS Focus Pack. You can engage in the conference if you wish to do that. You can engage in so many different things. So it's one of those events that would be really, really important for you to participate in and help shape going forward. All these events really help to inform the specifications, make things better, and there's no better way to do it than by having some experiential learnings that come from testing. The testing that IHE does is on the Connectathon really helps position you for the marketplace. So you have a couple of options here. First of all, you can do some at-scale testing where you haven't done it before, for example, with 3 trading partners. And people are coming to the Connectathon saying, I want to test IPS or SIPS, and I need people to test with. And you need to be those people. It helps prepare you for the marketplace. It helps prepare you for the international marketplace. It also can help prepare you for the Canadian marketplace, because the Canadian marketplace is an implementation of IPS. This will give you direct exposure to that. And there's a very, very actively developing marketplace in Canada. There's already been 2 Projectathons in the past. This is the 3rd one. So there's so many opportunities in so many different spaces here. John, Daniel, do you want to make any closing comments before we get to the questions?
No, I just reemphasize really what you said, Mike, which is it's a real opportunity for bridge building, and also just an opportunity to take, when I look at SIPS and the IHE profile for that, such a remarkable reuse of existing infrastructure, right? We don't need to build new things from scratch to really make this work. IPS gets to leverage all of that hard work that's been done for many years from the community for it. So I think that excellently said.
Okay, Daniel, anything in closing? No, good. Okay, Emily, you mentioned there's a question in the Q&A tab. I don't know how to get to the Q&A tab, so I'm going to have to rely on you to read the question.
Well, no problem. Yeah, I'll go ahead and read it out loud. So it says the IPS is described as a minimal and non-exhaustive set of basic clinical data, which I would correlate with a CCD template in CCDA as it focuses on patient-level information. Is there any plan for a standard encounter level summary document? And that question is from Ryan Brickner.
Yeah, no, I think that's a really good question. I mean, Mike, I'll try to take a first stab at this, but you, Daniel, feel free to weigh in on this. So I have a long history with CCDA and CCD, which is CCD and CCDA are really U.S. focused standards using the CDA. CDA is international from that perspective, from HL7 for it. But that CCD was really meant to be a longitudinal view of that information, which has a lot of similarities. Ryan, you were right to point that out to IPS for it, because IPS is meant to be, again, a summary which may not be from just one encounter. It is not a discharge summary. It's not an encounter summary. It really is meant to be that history of all relevant medical data that really informs those care transitions for things. So there is a lot of equivalence with CCD, but the CCD does actually kind of fulfill a lot of the data requirements for IPS, but has obviously a long history and a lot of other requirements that do tend to be a little bit more US centric for that. So there is definitely differences for it. But to your question of is there plans for an encounter level IPS? I would say right now there is not. You're not the first time that this question's come up for it. But right now there is not a formal track associated with that within the IPS standard. I think it's a really good question because people are beginning to say, once we have this infrastructure of a FHIR document, how would we do a discharge summary? How would we do an encounter summary, more limited and also more focused on provider to provider transitions for it? And there is some emerging work. There was a new profile for FHIR clinical documents that was just validated in September for it. And I think that that's setting up some infrastructure, some kind of foundational work that other types of more use case specific summaries could be based on. But right now, IPS is focused on that more longitudinal view for that information, and we don't have any specific plans to do an encounter one. But this is not the first time it's been discussed. But Mike, anything you'd kind of color that as well?
You've hit a very important point that keeps coming up, and interestingly enough, one of the countries that participates most in developing the IPS standard specifications is in fact the U.S. ONC-ASTP has been doing this for many, many years now, very actively, but largely in support of the Global Digital Health Partnership. The implementations in the United States are probably lower than anywhere else in the world, but there are implementations. The state of Washington has an implementation, and there's active discussions about what are we going to do about the IPS in the US. And there's a long history, as John has mentioned, on CCD. And moving a slow-moving vehicle that's very heavy to a new course takes time. So believe me, your U.S. government is hearing these messages, and I do believe that there's a lot of energy in the U.S. around IPS, and I would predict that in the future there will become much more alignment from what's going on in the U.S. to the international version of the IPS. That's my hope as well. We have a question. Are you working on the RFC 7522 and RFC 7523 to use FHIR API instead of documents, such as XDS, using public key infrastructure, decentralized, federated, instead of regional infrastructures? John, I'm going to punt this to you. I think you're closer to it than the rest of us.
I'm going to have to punt a little bit on this one. I'm Marlene, happy to take this one and do a little bit more research on RFC 7522 and 7523 for this. Obviously the public key infrastructure is part of what's being done for the WHO and GDHCN aspects of things for it. So, but I'm not as detailed into how that actually interfaces with the FHIR APIs versus something like XDS or XCA for it. So I'll see if I can actually respond to you offline in regards to that. But I think that the one thing I do see that I think I can comment on here is that you see that when Daniel was talking about the plugathons versus the connectathons, and also patient mediated versus provider mediated. There's a spectrum of things that are being examined as part of this event for it. So I do think that there's a lot of opportunity to participate and to learn about different avenues here.
Let me add to that also, the sharing of IPS, the SIPS profile was built to enable an infrastructure that is a document sharing infrastructure that happens to be very, very popular around the world. So there is a lot of pre-existing document sharing infrastructures, and the SIPS profile was really created to leverage that. That's not to say that other infrastructures would not be equally as appropriate. So really, the way IHE approaches this is there's IPS content that is expressed by an IPS profile, that is a content profile, and then there's the sharing of IPS profile that uses a particular type of infrastructure, an infrastructure set, as Daniel has pointed out. So there's lots of optionality here, and we're just at the beginning of a very, very long journey, and we'll see these infrastructures grow over time. So I expect there'll be lots more conversations about how can IPS be best facilitated. What we want to do at the end of the day is make sure the content gets from point A to point B to satisfy a particular use case, so that a receiver receives exactly what a sender is intending to send or pulls it. Yeah. So that's really the objective. All the cross SDO group is really working heavily on that. Daniel?
I'll add, I'm not familiar with those RFCs offhand like that, but I would add that the MHD specification does leverage the FHIR APIs for exchanging IPS documents. And then the Canadian CAFEX is also a FHIR-based exchange for the IPS documents. So we could try to reconcile that versus the RFCs mentioned.
This is a very interesting discussion that might fit beautifully within one of the Plugathon tracks around IPS as well, different infrastructures and how do we satisfy the needs of the globe. So yeah, thank you for that. Any other questions before we wrap? I'd like to remind everybody that this presentation and the video recording will be available at the IHE International YouTube channel. If you have any follow-up questions, please feel free to propose them. We'd be happy to answer those questions. And thank you for joining. I really, really hope that we see many of you deciding to attend the IHE North America Connectathon week. And we look forward to a lot of activity on IPS during that week. So with that, we will adjourn. Thank you very much.
Thank you, everyone.